You're now live, Chairman.
Thank you very much. Good morning. I'd like to begin by welcoming those members of the public and press who are watching this live stream of this meeting on via Cambridgeshire County Council's website. There's always a risk that we may run into technical problems, and I would ask for you to be patient. Should this occur, I will declare an adjournment while the fault is addressed and the public broadcast will be paused. If it's not possible to address the fault, the meeting will be abandoned until such times it can be reconvened. Can I remind members and officers that all virtual meetings are being recorded, and the recording of this meeting will be published on the Cambridgeshire County Council website. And I'm sure I don't need to mention, please keep your cameras on at all times and keep yourself muted unless asked to speak. If you wish to speak, please raise your hand so that I can see who was it and take you in the proper turn. I'd like to start the meeting. So had the resignation of Councillor Hickford. I would like, I'm sure the committee would like us to record our thanks to him for his contribution to this committee. And we've been in touch with the County Council, who can't reappoint their person because it has to be the chairman of the Wellbeing Board until the 16th of March. So we do have a representative in Councillor Hudson from the County Council, but
can't hear you, Chair.
We can't appoint the new acting vice chair or joint chair, whatever what would be called. So I will begin by calling the names of all members of the board to establish your presence. Councillor Fitzgerald. Not yet. He is about, because I've spoken to him. So Councillor Hudson. Councillor Hudson, are you present? Are you not hearing me? I'm
Present, Chair. Yes, Chair.
Yeah, okay. Councillor Hudson is here. Dr. Robin?
Present.
Wendy, over Wellborn?
Present.
Adrian Chapman?
Present, Chair.
How's the heater working?
Certainly is.
Good. Louise Camphor? No. Gary Howson?
Morning, everyone.
Bill Handley? Councillor Bill? No? Can't see him anywhere. Ray Bisbee?
Present.
Val Moore?
Present.
And myself, Councillor Holditch. Okay. Just a couple of alterations to the agenda. You've been sent a separate paper for all the figures that we've paid out on the CODIF, and that's on agenda 8. That's been sent the details of that. And on agenda 6, we've got Adrian talking about vaccinations, and that's the fact he's going to talk about the government's visit. So I hope you knew that, Adrian. Okay, so we'll go to item 1. That's apologies for absence. Do we have any apologies for absence, please?
I haven't received any, Chair.
You haven't received any. Okay, fine. Then we'll proceed. We are Cora, I take it.
We've received apologies, I think, from Charlotte Black.
Okay, we'll record those.
We are Cora, yes.
Yeah, we are Cora. That's the main thing, isn't it? Okay. Any declarations of interest, please? Okay, then I'll go to item 2. We've been asked to approve the notes of the minutes of the 10th of February as a correct record. Do I have anybody objecting to approving them? Please show. Do you wish me to have a mover and a seconder?
No, Chair, that's fine.
Okay, fine. And you're happy there's no objections? Yeah. All right, so we go to item 3. Okay, this is the action log. There is one action on there. Christine, it doesn't say that you resolved it. Have you?
If that was the action to send round the video of the faith leaders, it was resolved about 10 minutes before this meeting, Chairman. I do apologise for that, but you, as a bit of a bonus, I've sent you not only the video that didn't work in the last presentation, but all of the faith videos.
Okay.
So you've got a treat after the meeting.
Oh, you're so kind to us all, aren't you? Okay, so we're going now to any questions on that to Christine? Okay, item 4 then. No public questions, I don't think, is there? Daniel, any public questions?
No, Chair.
Okay, so we'll go then to 5, which is the update on I'd never say this word. Liz Roby, item 5, hematology or whatever. So over to you, Liz.
Okay, thank you, Councillor Holditch. So I'm updating on epidemiology and response. I think I will turn my camera off because my internet connection's a bit unstable. So you'll be able to hear me, and Daniel will put up some slides for me to speak to.
Okay. Can everyone see those okay?
I think they're probably fine. Thanks, Daniel. So this is our review for Cambridgeshire and Peterborough, and it is for actually for today, for the 2nd of March. Moving on, please, Daniel. So this is the national summary. You can see that nationally, the R rate is below 1. The number of positive cases has decreased, as have the numbers of admitted patients and deaths, and the number of virus tests conducted remains high. You can also see from the map of the UK that the blue areas are higher rates, green areas are lower rates, that Cambridgeshire County is part of a sort of block of green across East Anglia, Hertfordshire, Essex. Then a bit further north up in East Midlands, we get higher rates and blue coloration, and Peterborough's rate, you can see darker blue is particularly high compared to others at the moment. Next slide, please. So case rates, it's important to emphasise, have fallen in both Cambridgeshire and Peterborough. So the light orange line on the graph is all age case rates for COVID-19 cases per 100,000. The graph on the left is Cambridgeshire and the graph on the right is Peterborough. And what you can see is cases moving up, peaking in January and then coming down after lockdown. You can also see that the fall is sharper and steeper in Cambridgeshire and more gradual in Peterborough. And for both areas, you can see that the fall has been more gradual over the past week or so. In Cambridgeshire, it's tailed off and fallen more gradually. At lower rates in Peterborough, we had a sort of bump with a slight increase in rates and then starting to come down again. That is related to an outbreak at HMP Whitemoor, Peterborough Prison, where we have seen a number of cases, and because in an outbreak like that you do a lot of screening of people without symptoms, that has affected the overall rates in Peterborough, and that's why you can see that little bump in the Peterborough rates most recently, but they are still high. I would emphasise, even without the prison outbreak, rates in Peterborough are high compared to nationally. The darker orange or brown line on the charts shows the rates for people over 60. And what you can see, which I think is of note in Peterborough, is that the rates for people over 60 are much lower than the rates at all ages. So that's positive, because that actually does affect the number of people who become very severely ill. Next slide, please. So Peterborough and Fenland at the moment have some of the highest case rates nationally, so are in the top 5 nationally in terms of local authorities, and they're all age case rates. That is not because we had high case rates when we went into lockdown compared to other places, but during lockdown, other areas have fallen more rapidly. We've looked very carefully at this, and we think a lot of it is to do with the numbers of people who we have going out into frontline jobs in both Peterborough and Fenland, in areas like packing, agriculture, distribution, construction. People are still having to go out to work, so at a higher rate than in other areas, which means in a sense that things are a bit less locked down, although all the rules are being followed. People need to go out to work in essential jobs. And then many of these people who are a younger working age are coming back into houses where they live with several people, either other young working people or young families or large families, so that then if people pick up the virus when they go out, it then spreads. So that is why we believe our case rates are so high, and we're taking a number of steps to address that, particularly working with employers. So high rates in Peterborough and Fenland. The geographical effect is actually East Cambridgeshire, South Cambridgeshire, Cambridge have rates which are well below average. They have different employment patterns. Many more people can work from home. And so they are below national and regional averages for cases. Next slide, please. This just shows a slide to demonstrate the ages of people who have been catching COVID in Cambridgeshire and Peterborough over the course of the pandemic. So left to right is right from March through to March. It's the year of the pandemic. And from bottom to top, it's age 0 to age 90 on each of those charts. Purple is high rates, blue is high rates, yellow is low rates. So you can see for Cambridgeshire, moving towards the right of the chart, that we had high rates in working age people and older people in January, and those have gradually fallen. In Peterborough, what you can see is again high rates, purple rates in working age people and older people in January, and the older people's rates have fallen now, but you can see it's still purple for the working age population. We still have high rates in particularly our younger working age population. So that's what the chart shows. Next slide, please. Our numbers of patients in hospital shown on this chart in both Addenbrooke's and Peterborough City Hospital are continuing to decline. That's basically what the chart shows. Next slide, please. And sadly, there are still some deaths from COVID-19 within 28 days of a test, but these two graphs show, Cambridgeshire on the left, Peterborough on the right, that those deaths are now declining. Next slide, please. And we also look at the deaths from all causes in case people are perhaps not having a COVID test, which was more prevalent in the first wave of COVID. So these two charts show right from the beginning of the pandemic to the beginning of 2020 through to the current point. And for both Cambridgeshire at the top and Peterborough at the bottom, you can see that more death rates went up in the first wave in April, May. The orange on the chart is those deaths where someone had a positive COVID test. But you can see in the first wave that not all additional deaths were people who had necessarily had a COVID test. The blue line across along the chart shows the average expected deaths based on the previous 5 years. So for both Cambridgeshire and Peterborough, the deaths are above the expected rate back in April and May. And then when you come through to January this year, again, you see the deaths going up above the expected rates. Although I think you also see more positive COVID tests, partly because the testing system is much better now than in the first wave. So that puts those sad deaths into context. I think that's the last slide. So happy to take questions. Oh no, sorry, we have some key response actions as well. That was the last slide on the epidemiology. So happy to take questions on the epidemiology and then move very quickly through key response actions.
Okay, any questions of Liz? I'll start the ball rolling. Liz, is there any proof that because we've been vaccinating older people, that's why their rate's gone down?
I think I'll try my video on again. I think we're beginning to get there, Councillor Holditch. So we're starting to see nationally faster falls in hospitalisations amongst older people than amongst people in the younger age groups who've not been vaccinated. So that is starting to come through nationally now, yes.
Okay, I've got nobody else signalling to speak. I think you could move on.
Okay, thank you. And these key response actions haven't changed significantly, although we are obviously intensifying all our actions in Peterborough and Fenland at the moment due to the higher rates there. So we continue, and I won't go through it in depth because I've spoken about it many times before, but we continue our daily surveillance of cases, hospital admissions, and all other relevant information. So keeping on it daily through our surveillance cell. Excellent targeted communications and engagement from Christine's team, which is based on that epidemiology and on what's happening, and adapts very rapidly. Christine will update on that. Some very good campaigns at the moment. We have our local rapid response, which is working absolutely very, very strongly in Peterborough, and our rapid response Fenland Gold also doing a huge amount. And that's about rapid response to the epidemiology, engagement, enforcement and support interventions. And each of our district and city councils has their own gold and rapid response mechanisms so that this can be done at a level that works for the local community. We also have our Cambridgeshire and Peterborough wide outbreak prevention and management structure through our outbreak management team and its cells for education outbreaks, workplace outbreaks, care home outbreaks and vulnerable group outbreaks, and work closely with healthcare, the CCG on healthcare outbreaks as well. So that's very active at the moment, as always. Next slide, please. Our community rapid testing has had a lot of publicity recently and remains for people without symptoms who leave their homes regularly, and there are further national developments on that you'll be aware of. We continue to carry out enhanced contact tracing and support for the clinically extremely vulnerable and for those self-isolating at home through the county-wide hub and local arrangements, and a huge amount of support coming in through our county-wide reference group, the voluntary sector, and Adrian sort of in a sense has the officer leadership role and does it very, very well, but a huge amounts of support coming in from community and voluntary organisations right across the piece. And of course, the vaccination programme, which we're all aware of as absolutely key to moving us through and moving us on with this pandemic. And that is the end of my slides. Thank you, Councillor Holditch.
Thank you. This is a question I'm going to put to you. It's not exactly, I can't see anything else on the agenda where I can hang this on. But for the last four mornings, Cambridgeshire Radio have been slagging us off for having a very low rate of vaccinations. And they quote where we were up high, and of course they're now saying it's only 20% of what it should be, or whatever they're telling me. Could somebody get onto them and explain what a push model is, and it's about availability of thing and not our ineffectiveness of delivering it? Do you think you could do that? Are you listening, Christine?
Yeah, and I think I can certainly comment on that. I think Gary may be best placed to comment on the vaccinations and the impact of the way that vaccinations are received on our overall rates.
Okay, thank you, Liz. So yeah, absolutely. I mean, the model we know we have capacity to give the vaccines. That was demonstrated when we had a high flow of vaccine into the system. The PCNs, the GP practices, hospital sites and the large vaccination centres we're able to put a large throughput through. There has been a slowing of vaccine supply, I believe, during the course of this week. I've not seen the latest figures for this week yet. But once supply is increased again and more is pushed into the system, then we have the capacity to give it. So I'm confident that if we have fallen behind slightly, that it will be something we'll catch up as soon as the vaccine is available.
Okay, I think somebody ought to correct the statement they're making, because it doesn't reflect that at all. It looks as if we're being totally ineffective.
I think it's important to remember on the last figures, Councillor Holditch, we were, when they were released, we were third in the country for cohort penetration. So actually, I think it's very important for people watching this that they understand that we're actually one of the national leaders, and we were lauded when we had the supplies for the way in which we were able to get it into our population. And that reflects not only the teams giving it, but the engagement of our population to come forward and have the vaccination. So thank you.
That's exactly the point I was trying to make. You know, we can only deliver when we've got the stuff. Okay, so any questions on that from Liz or anybody? I've not seen anybody wishing to speak.
I think Adrian Chapman has a hand up.
Does he? Oh, Adrian Chapman, you got your hand up?
Thank you. I do. I just wanted to reinforce the point both you and Gary have made. I sit on the strategic vaccination goal group and can absolutely reassure this board and anybody watching that we remain in incredibly good shape. So the rollout of the vaccination programme is going exceptionally well across Cambridgeshire and Peterborough. You know, well on target, and notwithstanding the supply issues that Gary's mentioned, I really don't think there's any cause for any concern whatsoever.
No, neither do I. But if you listen to Cambridgeshire Radio, you would think there was. Councillor Hudson.
Thank you, Chair. This is mainly, I think, to Ray. We've heard how everything's going well with the vaccination, and I've been out and I've seen that happening. But we're looking at the really large, excuse me, infection rates in Peterborough, and in the Peterborough Evening News, around about the 20th of February. I don't know whether you could see this, can you? That's a picture of Ferry Meadows, and there's a caption saying, "Don't worry, everybody." Around Ferry Meadows and Ortonmere, lockdown's been cancelled, and you can see car park full of cars, ice cream vans, and everybody's out having a great time, which I get completely. Ray, is that legal? Is it right? And if it isn't, did your guys go in and sort them out?
Yeah, they had to close the park as a result of it.
Yeah, well, that's good to hear. That's good to hear.
Yeah, they did.
I can just say that the police did respond to it. It is illegal, and the police will respond to anything that is illegal until it becomes a case that it's no longer enforced. But at the moment, I would ask all the public to please continue to abide by the regulations, and the police will come down hard on people when they need to, because it's putting other people's lives at risk, including the police who have to attend.
Thank you, Ray. That's good. Thank you.
They put some other controls in for the future because I think they were all taken by surprise by it. Yeah. So good question, Gary.
It's just to come in quickly at this point as a clinician to back up what Ray's just said. Well, obviously, we're focusing on the vaccination programme on this item and saying how important that is, that continues to roll out. That's absolutely the case, but I don't apologise for saying again that the social distancing rules and the very simple measures we've been asking people to take around hands, face, space, and following the lockdown rules are equally as important in this stage. Although the vaccination programme is going well, we're still with first vaccines only, and there's still a large percentage of the population that haven't had their first vaccine. So it's just a plea really that people remember the very simple messages that we've been reiterating at this board and elsewhere over the last few months. We're not out of the woods yet. We still have high levels locally, and it's really important that we all play our part to make sure that virus transmission is reduced. Thank you.
Excellent. Did you want to come back, Ray?
Yeah, I quite agree with what Gary's just said. And actually, I would encourage people, even after lockdown has come out, to continue to keep washing their hands and keeping themselves away from public as much as they can. You know, it's something that is mutating all the time, and we don't know what's going to happen. So I would say keep taking those precautions, and the police will keep enforcing them.
Yeah, I can always remember my mother telling me to wash my hands. It's not a habit you get into, is it? It's a habit we've got to get into. Okay, I don't have anybody else. Is that a legacy hand, Gary?
Yes, if it's still up, sorry, I thought I'd load it. I'll try and rectify that.
No, I'll move on to item 6, and that's Adrian, who's going to talk about the Cabinet Office visit.
Great, thanks, Chair. Morning, everyone. So I'll just give a brief verbal update on the visit we had last week from the Cabinet Office field team. We were very fortunate to be able to welcome them into Cambridgeshire and Peterborough. Particular focus on Peterborough and Fenland, and especially Wisbech in Fenland, because of those rates that Liz has shared with us this morning. The COVID-19 task force has been set up by number 10. It sits within the Cabinet Office, and the field team are part of that task force, and they are the team that visited us last week. They've got, really important to note that they've got a direct line into number 10, so carry with them a great deal of knowledge, but also influence. So I do use the word welcome them to Peterborough and Fenland, to Peterborough and Cambridgeshire advisedly. I think it was a really good opportunity. So they understand that we've been making huge progress on addressing the transmission rates in the north of the county in Peterborough and Fenland. And despite our best efforts, those rates weren't falling as fast as they're falling elsewhere in areas that are broadly similar to ourselves. And this board, we've shared with this board over the months some of the work we've been doing, which they are aware of. So going ahead at pace with rapid testing, all the work we've been doing around vulnerable and isolated groups. As Liz mentioned, really expansive communications and community engagement activity, joint enforcement patrols with the police, private sector marshals, voluntary sector marshals, and local council officers, and lots of work with employers and workplaces, and a really tight grip through our Director of Education on school outbreaks. So that was the context. They understood that we were doing all of that work across both Cambridgeshire and Peterborough, and still our rates weren't coming down at the right rate. And we then were presented with an opportunity to invite them along to Cambridgeshire and Peterborough, and to have them do a fairly forensic look through all of our activity, the way we're gathering our information, the way we're working with our partners, and actually what the reality was like out there in our communities. The visit is not an inspection, it is not a judgment on our activity, although clearly we were keen to hear their views on how we were doing. It was, though, wholly supportive, very collaborative, really flexible. We were able to change the programme between Wednesday and Thursday based on what we found by close of play on the Wednesday, and was really about the Cabinet Office field team getting under the skin of both Wisbech and Peterborough and understanding the way that the whole system operates. So it's a 3-day visit. It combined a lot of strategic conversation, lots of meetings with political leaders, senior officers, system leaders, lots of operational discussions. So the field team joined a number of cells, the workplace cell, the care home cell, the vulnerable group cell. They met with the CCG to talk about the vaccination programme and had discussions with Christine and colleagues around communications activity. And then a huge amount, by far the majority of the visit, was the practical work that the team carried out. And that comprised lots of individual meetings with community leaders, community activists, community groups and organisations, as well as getting out and about on the streets. They spent all of Wednesday afternoon into the evening in Wisbech, and spent Wednesday afternoon in Peterborough. At the same time, they split themselves in half, speaking to a number of Peterborough residents and communities. One of the points as well, one of the benefits of the team is that they've also got links into the region and to national colleagues. So all the time in the 3-day visit, they were playing stuff back up to the region and to the national team, checking whether or not there was anything they could advise, and then bringing it back down into the conversation. The feedback on the final day from the field team was incredibly positive. They, I think fair to say, recognise that we are doing all we can within the constraints of the situation we find ourselves in. The visit, they said, was wholly co-produced. It was incredibly productive. It's given us some key pointers for action. So there are some things we want to reflect on as a result of the visit, as you'd expect. We've used this as an opportunity to hold a mirror up to ourselves and ensure that everything we're doing is timely and relevant and targeted. But also they've taken away a series of fairly crucial points to consider at a national level, because they recognise, as I've mentioned, that we are doing all we can. They very much congratulated us for the activities that we were delivering. There was no silver bullet that they could identify that we weren't already firing, which is incredibly reassuring, but equally frustrating in some ways. And so they've taken their findings back to the national team. We will receive a report this week. We think it will be fairly light in content, but punchy, dynamic, we're promised, and very supportive of our system. And I would suggest at our next meeting, when we've seen that report, we'll be able to talk in more detail about the implications and opportunities that the visit has presented. But overall, a hugely positive experience, very, very collaborative. They noted how we had co-produced effectively the visit and its findings with them, and we were incredibly transparent and open, and they acknowledged that. So all in all, a very successful experience. Thank you, Chair.
It was also a very professional experience. I mean, they were military people that basically were interviewing us, and they did it properly, didn't they?
They did. So the team is made up of serving military and civil servants, and the two military officers that were present were very senior military personnel, and as you say, Councillor Holditch, highly professional, but incredibly open to listening, learning. There was no arrogance, no preconceived ideas. They were very much open books and did learn a great deal, actually. And I think a lot of the learning will be taken back into the national team, and I'm sure will benefit a number of other areas that are facing some of the same enduring transmission issues that we're facing.
One was a Navy officer and one was an RAF officer. I asked whether there was any arguments about who was the senior service. But there you go. Okay, members, any questions of Adrian? Can't see anybody putting their hand up. No? Okay, must have been a good presentation, mate. Thank you very much, as usual. So we'll move on to item 7. Liz, roadmap, please.
Thank you. And yes, I'm just going to briefly present some key points from the government's COVID-19 response plan for this spring, which is described as the roadmap to cautiously move us out of lockdown. So this was published last week, at the beginning of the week, and just pulling out some of the absolutely core points. It headlines clearly the role of science and the role of vaccination as moving us forward in our COVID-19 response and the impact that COVID will have. So it's clear that vaccination will reduce the impact of COVID-19 on hospital admissions and deaths by protecting initially the most vulnerable people and then a much wider part of the population. So that's core, but it does also make clear that not everyone will take up the vaccine. Children are not yet authorised to receive it, and it doesn't work 100%, so some people will still be vulnerable. So it outlines a measured and cautious approach to easing lockdown as the vaccination program continues to deliver and get more people vaccinated. And that's very clear tone of the roadmap document. So it outlines 4 steps to easing the current lockdown restrictions. Before moving between each of those 4 steps, it outlines 4 tests which need to be satisfied from examining the data. And those 4 tests are that the vaccine deployment continues to unroll, that the vaccine is effective in reducing cases, hospitalizations and deaths, that we're not seeing a surge in infection rates that's putting a lot of pressure on the NHS, and that the game isn't changed by a new variant suddenly spreading and becoming much more prevalent. So those are the 4 tests. And the plan absolutely describes this gradual, stepwise moving out of lockdown. The reason for this, and I think it's important to go into the science behind it, is that each of the steps outlined, and clearly the first major step is the opening of schools on March the 8th, each of those steps will increase our R rate. It will increase the rate of transmission. Or is highly likely to. So all the research shows that when a lot of, when schools are open, there's more transmission than when they're closed. And that may not be within the schools. It may be people going to and from the schools. It may be children socializing outside school. It may be the perception of society that it's a bit relaxed. But the impact of opening schools may well lead to an increase in transmission, and we need to analyse that, and we need to look at that over the weeks following that opening. And that's important, because if we're going to judge that opening of the schools properly, if that's going to be properly monitored and understood at national level, that means that all the other bits of lockdown which haven't been lifted have to stay in place. So I think there's a temptation to say, oh, well, we're coming out of the main lockdown, we're opening the schools, we can all relax a bit, we can all go out to the park, we can, start doing things that actually the lockdown will still say we shouldn't. That people sometimes may react in that more general way, but it's really important for this phased coming out of lockdown that we just make the changes that the plan says. So the children go to school. People in a care home have 1 visitor, and there's slightly more flexible on 2 people meeting outdoors for socialising as well as exercising. But it's so important that everyone, our residents, understands that we must carry on with all the other lockdown measures. We must only change what that map changes. Otherwise, it'll be really hard for the government to monitor the impact of those changes and say that, yes, we've seen this, we might adjust, tweak this way, that way. We've looked at all the data, now we can move on to the next step. So I wanted to emphasise that point. And I think that can be quite a hard point to emphasise. The plan itself is very clear that it's essential for everyone to maintain their good habits. And even as we go through the different steps, it's going to be incredibly important that people keep their social distancing, their hand washing, wearing face coverings when needed, going for a test when needed, all of those behaviours, that needs to continue right through. And that is clear in the plan. But I think it's quite hard to communicate to the public this sort of rules-based approach and this stepwise approach, which in terms of the science behind that unlocking of the lockdown is so essential. So I think I'd hand to Christine now, perhaps, and just sort of, but also to all of you, to firstly to say whether what I've said makes sense to you, because I've done my best to express it, but my mind is sort of worrying the maths a bit, but hopefully what I've said makes sense. And then to think about, get contributions from this board on how we can really get that message across effectively. I think that there's been some great work done on getting the vaccination messages across through working with counsellors, toolkits for counsellors, and so on. But I'm just wondering how this board can help to get these messages about the stepwise reduction in lockdown really understood. I'll stop there.
Okay, Christine, do you want to comment on that?
Just very briefly before you have a wider discussion, we are obviously working suggesting or message areas with the lockdown, and we've come up with the phrase "this depends on us," and that is about stressing all the way through that this is something that is, you know, for us to still take action on. It links in with all the campaigns that people have mentioned before, that we're continuing with. So the Stand Firm campaign around people keeping to the rules, the Be Part of the Solution campaign that we're just rolling out. We've done a very successful film with young people in Cambridge. We're just launching a film which we've done with young people in Peterborough, and that's about young people themselves saying how they want to be part of the solution to ending. We are looking to work on all of those, but we're sort of putting an overarching message of this depends on us. And I'm now sort of working through all the various steps of the roadmap and the sorts of things that we will need to be prepared for. So to get people's views on that and views on how we can properly roll that out, and places we need to go to, people we need to talk to, areas we need to influence would be really helpful.
Okay. Val, you wanted to say something? Al Moore?
Thank you. Yeah, the roadmap doesn't describe anything about the opening up of the health and care services as such. It's more about the visiting care homes or the society in general, schools, etc. We hear the messages constantly that the NHS is still under pressure, which of course I know and understand. But Gary, I wonder if you can explain the approach about opening up health service over the coming weeks and months, and what's the thinking around that, and how it can be equal for people across the patch, but also take account of the terrific pressures that have been on staff currently, and understanding many of them have been pulled into the vaccine effort as well. But what can you say about the opening up of health services for people?
Okay, you happy for me to take that now, Chair?
Yes, please.
Yeah, so I mean, first thing I'd want to do, Val, is stress that health services are obviously open for things other than COVID at the moment and have been through the pandemic. So to reassure people out there, if they do have any symptoms that they are worried about, then general practice is open. They should be contacting their surgeries. It is indeed true that general practice is playing a major role in the vaccination programme, but that is not at the expense of availability. People will still be accessing general practice in a slightly different way, often through a telephone call to start with, so that we can keep patients as safe as possible and only bring them down to healthcare facilities where needed. So that's the most important thing I want to stress. Absolutely, the next stage is system restoration and recovery, and it will be a balance between getting those most essential services back up and running at a higher capacity. It's about making sure people with the highest need are able to access healthcare services. It's about empowering people with self-care. I certainly know from my experience as frontline GP that people have really stepped up and taken charge of a lot of the health issues that perhaps they once would have phoned a health professional for. They're feeling empowered to do that themselves now, and that's something very important that we need to hold on to. But also to reassure people that we are fully cognizant of how difficult it's been for people to receive the level of service they may have done previously, whilst the COVID pandemic has been the priority. It's not going to be a quick recovery. The workforce have been working incredibly hard over the last 12 months. There's going to be a period of time where health professionals, care professionals, social care professionals are going to need a bit of a break, an opportunity to recharge their batteries. And I think it's, as we've just said, the solution to this isn't going to be just on the health service or the care service. It's about populations and communities as well. So it's something that is in the planning stages at the moment, but really important to stress that first message that if people have been sitting on symptoms that they're worried about, especially if there's anything that they think may be cancer, please do come forward, because cancer services and those emergency services are still running and have been throughout the pandemic. And obviously more details will become apparent as we start to turn things back on. I very much hope we get back to activity as usual, but people talk about business as usual and the new normal. I don't want to go back to the way we were doing things before. We've seen some massive transformation in the way health services are delivered remote outpatient consultant clinics, so people don't have to travel up to the hospital, diagnostics closer to home. We've got mobile CT and MRI scanners. And I think there's a whole host of changes that we'd want to embrace and keep hold of as we try and step back up to previous capacity levels. But it's going to be challenging, and it's going to be a long haul. It's not going to be an overnight case of switching things back on, largely because there are backlogs both that we're aware of. There are people sitting on waiting lists, but I suspect backlogs that are hidden within the community that GPs have been looking after that haven't been referred on to further services at the moment. Thank you.
Thank you for that, Gary. I think that was a good statement, because that is what's concerning a lot of people, I think.
Councillor Holding, could I just answer Liz's correction directly? That's why I had my hand up. She asked if we thought the message she was giving was clear, and I think absolutely, Liz. I think it's really important that people understand that the process of stepwise removal of restrictions whilst maintaining all other restrictions in place is so important, because otherwise we won't know if we do run into a spike of transmission and infections, we won't know what the trigger is. So I think that message and the way you articulated it was very clear, and I'm sure Christine and the other comms teams across the system are working on that, and I think that's a very clear message, and we know from the past that it's those clear, simple messages that people can understand are the ones that have the most impact. So thank you.
Yeah, thank you, Gary, for that. I had nobody else showing, so I will move on then to item 8. Now, you've had some additional papers, I think quite a few additional papers with a lot of figures on them. So Kate, you've got the job of making this simplified.
Of course, okay. So you've been presented with two spreadsheets, one from the Test and Trace grant and the other one from the Contain Outbreak Management Fund. These were both funds that were provided to upper tier local authorities. The first one is the Test and Trace grant that was provided in 2020, about June 2020, and it's where we put our original COVID-19 spend allocated against it. And the second spreadsheet that you see is regarding the Contain Outbreak Management Fund, and that was provided in October last year, and that was very much around an allocation around when the local authorities were in different tiers, so the amounts were very different. The process that we've been taking in regards to actually awarding funding against these grants was through business cases, which we've received in a finance subgroup, and the representation on that finance subgroup had the Director of Public Health, Director of Customer and Digital Services from both authorities, and also we had representation from the CCG, from Carol Anderson, and the district councils were represented by Joe Brooks, who's Chief Operating Officer for East Cambs District Council on behalf of all the districts. And so really what you're presented with is the decisions that have been made in regards to spend against the two different grants that we're holding and that we were allocated from the Department of Health and Social Care. So underneath each of the categories, you've got examples of the business cases that we received in a little bit more detail, but obviously there is an awful lot more detail behind each of those business cases. So this is an opportunity for you as a board to just review how the spend has been allocated at this stage, and we are still looking and working. In fact, we had a meeting yesterday, so more business cases were agreed and will need to be updated into the next kind of spreadsheet that we bring to you.
I think getting the papers that late, Kate, you're going to have a job to get some detailed questions. But
yeah, I totally understand. I was basically trying to kind of put it all together for you at the weekend, so I do apologise for that. But an opportunity to kind of send any questions directly to me, and we will bring it back to the next meeting so that you can have a further kind of perhaps more in-depth discussion. And as I say, if you do have specific questions, it would be useful to know what they are, because I don't hold all the business. I hold the business cases, but I didn't write them. So it might be that we need to invite particular people in to comment on any areas that you're particularly interested in.
Thank you. Liz, you wanted to say something?
Yes, just very briefly, and Kate has done a huge amount of work on this together with our finance colleagues who also sit on the subgroup. So a lot of thanks to Kate and to finance colleagues involved to doing all the work to pull this complex piece of reporting together. I would just say Kate referred to the finance subgroup, and just to outline the governance, that is a subgroup of the Health Protection Board, which has the oversight of the local outbreak control plan, and all this spend is about implementing the local outbreak control plan. It's the government grants for that. So that's just the background context, and then you can actually look at the categories of spend and see that falling into place against the local outbreak control plan that we've got. So just a little bit of just further background there.
And ultimately, this panel ought to be pointing in the direction of how to spend it.
Yeah, we're very, very grateful to have your comments on it. Obviously, it's often very rapid, very fast moving. But yeah, we wanted to bring it to you so we could get your comments and get your steer. Thank you.
You again?
Yeah, sorry, I'm not one to be commenting on the detail of the figures, but I did notice one of the few rows to be confirmed is the enhanced support for vulnerable people, and I'm pretty sure that's been a focus all along anyway, so I'm assuming there's a new pot of money or something, but is there something more you can say about that?
So that, yes,
that stream, and it's not an afterthought and the last thing we've got round to in the scheme of things.
Not at all, not at all. In fact, some of the other business cases do actually have support for vulnerable people included in them. So obviously the detail isn't going to be captured in a short kind of two line description. The one that you're particularly bringing up has actually been agreed in principle. We're just working out the fine detail of how much. So that's why it's not got costs assigned to it.
Is that code for you couldn't agree on how much to spend on it?
No, that's code for working in partnership and and making sure that we actually get the right response and the right level of provision.
And thank you for the paper. So we weren't being critical, but there it goes, isn't it? Okay. Yeah. Sorry about that. Yes. Anybody else? No, you've got to wait light. You have to send the papers out again. Yeah.
Thank you.
Right. I think on that, we'd like to thank any members of the board wishing to speak. Questions? No, there's nothing to move on. We're just noting your report, and thank you. Your explanation was very clear. Thank you, and you do it with a lovely smile. Excellent. Okay, I think I'm free to go to item 9. You happy with that, Daniel?
Yes, Chair.
Yeah. Okay. So I'm going to move to item 9. Any other business? Okay. I don't see any, but I just I think since we last met, Dr. Robin has announced her retirement. And I dare say we will be meeting again before that comes into effect. But if we don't, I'm sure we would like to record our thanks for it. I mean, we've all worked very closely to her, and we know what a hell of a pressure she's been under in the last few months. And thank you very much for what you've done, Liz. But I'm just asked Gillian Beasley if she'd just outline what we're doing about a replacement for Liz, please. Gillian.
Thank you. Thank you, Councillor Holditch. So we're going out to advert this week for Liz's replacement, and we anticipate that we'll be able to make an appointment subject to suitable candidates coming forward for the week commencing the 12th, I think around about the 12th of April. And Liz, myself and her colleagues are talking about arrangements we'll put in place, any interim arrangements. But so we've got that firmly in hand now, and obviously we'll keep the board appraised of how that process goes. So thank you for asking, Councillor Holditch.
Thank you. Any other business, Gary?
It's just to take this opportunity to say thank you to Liz. Obviously, with Liz working in the local authorities and myself on the health side, the level of support that Liz has given to us at the CCG and the level of cooperation and collaboration has been fantastic, and it's been a pleasure to work with you, Liz. So good luck with your retirement. Thank you,
Gary, and thank you, Councillor Holditch, as well. for your kind words.
I hope you're suitably embarrassed.
Yes.
Well done. Okay, I think that concludes the business for today. Is that correct, Daniel? Are we finished?
That's right, Chair. You're finished.
Right. Thank you very much. Thank you all for your